Thank you, Greta. Good morning. I would also like to offer my condolences to the family and friends of Jazmir Tucker. Jazmir Tucker's autopsy was performed by Dr. Schott on November 29, 2024. Dr. Schott then created a report of findings that I later reviewed for quality control purposes. I co-signed that report on January 14th of 2025. The first part of the examination involves documenting identifying characteristics and noting medical therapies and injuries. Evidence of medical therapies included an endotracheal tube or breathing tube in his mouth, vascular access lines in the bones of his right shoulder and right lower leg, that's his left shoulder and right lower leg, a chest seal over a wound on his back, which is used to prevent air leakage from the lung cavities, a thoracostomy incision on the right and left chest, which are surgical incisions that allow treatment for the lungs, a sutured thoracotomy incision on the left chest, which is a surgical incision to treat the lung, and IV access in the right wrist to allow administration of fluids. The autopsy examination determined that Jazmir had 3 gunshot wounds. These injuries include the following. 2 gunshot wounds injured his torso and 1 injured his right arm. It's not known what order these wounds were inflicted or what position Jazmir was in at the time the wounds were inflicted. 1 wound entered the left mid-back and injured the spleen, stomach, diaphragm, left lung, and heart. That bullet exited the left lower chest. The wound was associated with bleeding into the chest cavity and into the abdominal cavity. A second wound entered the lower back just to the right of his spine and injured the small intestines and the abdominal wall. This bullet was recovered from the tissues of the abdominal wall just below the belly button area. The wound was associated with bleeding into the abdomen and lacerations of the small intestine. A third wound involved the right upper arm. This wound injured the muscle only. The arm bone and major vessel in the upper arm were not injured. The wound characteristics were not specific enough for us to indicate which wound was an entrance and which was an exit in that arm, and no bullet was recovered from that wound. Jazmir had no other significant traumatic injuries, and he had no significant medical diseases. Toxicology was positive for a marijuana metabolite in his blood. The cause of death ruling in this case was gunshot wounds to the torso. Cause of death describes the injury or the illness that results in the death of an individual. The manner of death was ruled homicide, shot by another. Our ruling of homicide is a medical conclusion. It is not a legal conclusion. It means death at the hands of another. The manner of death describes the circumstances surrounding the death of an individual, and we have 5 different choices there. The first would be natural, which is due to natural disease, such as an infection, heart disease, or cancer. The second is accident, which is due to injury or poisoning that was not intended to cause harm. Suicide is an injury or a poisoning that was inflicted with the intent to cause self-harm or death. Homicide is just death at the hands of another. Undetermined is used when we don't have an ability to separate 2 competing manners of death based upon our investigation and our examination. I understand that there have been questions raised regarding the performance of gunshot residue testing. First, allow me to explain what gunshot residue testing is and some additional information regarding the testing. Although the technology used to demonstrate the presence or absence of gunshot residues is sound, there are many factors that contribute to false positives or false negative results. Gunshot residue testing can detect specific particles related to the discharge of a firearm, but the results of such testing are not conclusive as to whether an individual did in fact fire a weapon. The particles are very fine and easily dislodged from the skin by acts as simple as putting one's hands into one's pockets or even by sweating. A positive test does not indicate that a person fired a weapon. A negative test does not mean that the person tested did not fire a weapon or was not in the vicinity of a weapon. The FBI discontinued their gunshot residue testing in 2006. Based upon the issues related to the interpretation of the testing and the ease with which particles can be dislodged from the skin, the medical examiner's office discontinued collecting these samples in 2016, and we no longer purchase the collection kits for use by my staff. Because of this, Jazmir Tucker's hands were not swabbed and were not tested for gunshot residue testing. Upon my co-signing of the report, members of the executive staff provided the report to Jazmir Tucker's family by way of their attorney, as was requested prior to this media announcement.
At this time, we will take a limited number of questions. Please be aware that Dr. Kohler will not, excuse me, Dr. Kohler will not speculate, and we will not comment on the ongoing investigation that's being completed by BCI.